Hey guys, we're going to talk to you about something a little different today. I've had a few people ask me in the office if I think that it's safe to use marijuana in pregnancy, and I always kind of made a funny face. I don't know about that, but I've never really looked into it too much to really give a somewhat well-informed answer. So I have done a fairly deep dive into the data on this, and want to give you some information on that question today. So the first thing that I think everybody probably realizes just right off the bat is, if you're smoking something, then you're putting carbon monoxide and all kinds of other burnt things into your body, and that just can't be good for a baby. There's plenty of evidence in the literature regarding cigarette smoking that shows an association with small for gestational age babies. In other words, low birth weight. So, and that's a real concern. Obviously, you want your baby to be born a good, healthy weight, and there's many reasons why that might be. One reason is that carbon monoxide bonds very tightly to fetal hemoglobin, even more so than adult hemoglobin, and so there's less oxygen being supplied to the baby through the red blood cells. A lot of the carcinogens that are present in cigarette smoke are present in marijuana smoke. Often it's several times higher than what is in cigarette smoke. So you are potentially exposing your baby to some of these cancer-causing agents. That just doesn't strike me as a very good idea. Marijuana is legal in states surrounding Utah, so plenty of people have the opportunity to go out and get access to products. And I've heard some people have asked me, well, what about edible marijuana? You're not smoking it, you're not getting all this bad stuff in your lungs and all that. THC, which is the active metabolite in marijuana, is very what we call lipophilic, and that means that it dissolves very quickly into fat. And lipophilic molecules are also found in the brain. So there's evidence that the active ingredient THC is actually stored in the brain. That just can't be good. Another thing to know is that about 10% of maternal blood levels of THC are what the baby will be exposed to as it crosses the placenta. But that's for a single exposure, and there's evidence that with repetitive exposures, this stuff accumulates. So while you may only get 10% exposure from one dose, if there's repetitive doses, you can get higher and higher doses, basically getting stored in the brain cells. Of course, one thing that's kind of hard to say specifically about marijuana is how does it affect brain development, especially when you consider that a lot of people who use marijuana use other substances, so it can be kind of hard to answer with any definitive answer. However, there are some studies that would shed some light on this question. Endocannabinoids, which are, again, the metabolites of THC, are actually an important part of brain development. There's evidence that endocannabinoids are important for brain development in terms of neurotransmitter development, as well as what we call neuronal migration, which is where the actual nerve cells are moving to the appropriate parts of the fetal brain. Human fetuses have receptors for these cannabinoids as early as 14 weeks of gestation, so very early. And this, of course, is when the brain is developing very rapidly. There's also evidence that the combination of marijuana and alcohol use can actually accelerate what's called apoptosis, which is programmed cell death. So you can actually kill brain cells at a more rapid rate if you're using alcohol and marijuana at the same time. There's evidence that children who were exposed to marijuana in utero scored lower on tests of visual problem solving, visual motor coordination, which is like eye-hand coordination. It's also been shown that marijuana exposure is associated with reduced attention span in children and also associated with behavioral problems. And a real concern is that in utero exposure has been shown to be a risk factor for marijuana use by the age of 14 years. There is evidence that women who use marijuana more than 2 times a week have a higher risk of having a low birth weight baby. There's also an association between marijuana use and preterm birth. And moms who breastfeed should be aware of the fact that there is going to be some excretion of the same chemicals into the breast milk. So there's a lot of supposed benefits of marijuana use that people will claim, including easing their back pain and helping with appetite, and those things may or may not be true. I'm not here to say they are or they're not, but one thing's for sure, there's some really definite concerns about fetal brain development, how kids behave in the years after exposure, how well they perform on testing, and their own risk for use of marijuana in the future. So I don't think this is one of these deals where I can just say, oh yeah, there's no evidence that there's anything bad going on. And I definitely recommend anybody who's using marijuana of any kind while they're pregnant to stop right away. They may be putting their baby at risk for problems with brain development, problems with cognition in the future, problems with behavior, and as a risk factor for future drug use themselves. So I don't think I'm telling anything to most people that they didn't already figure out for themselves, but there definitely is a subset of people who will continue to use marijuana when they're pregnant. Up to a third of people who use marijuana regularly will continue to use it during pregnancy. And I think it's just important to know that there are some potential risks for your baby, and I don't think anybody would intentionally do something they thought was harmful. So I just want to make it really clear that there are some potential harms, and I would really recommend you consider not using marijuana while you're pregnant. Well, thanks guys for watching. I hope this information is useful to you. If you have questions, please feel free to put them in the comments below. If you like what you are learning in these videos, please consider to subscribe. And thanks for watching. Have a great day.